So my name is Renata Marinero. I'm Director of Health Services for the Entertainment Community Fund, and I am very happy and excited that you have all joined us today for Monkeypox, What You Need to Know. We have some really great, or a really great presenter today, Dr. Jason Kindt, and we have an ASL interpreter here, Courtney Nimmersheim. So welcome, Courtney, and thank you very much for your work with us today. I'm going to just briefly say a few words about Dr. Kindt. First of all, if you know him, you know he's fabulous. He's our medical director at the Friedman Health Center for the Performing Arts. And he is probably, I would say, maybe secretly a frustrated performer. Is that correct, Jason? Can I say that?
Right. When I lack in pitch, I make up an enthusiasm.
There you go. So he's going to be talking to us today about monkeypox. So take it away, Jason.
Great. Thanks, everybody. I know there's lots of questions, lots of fears, especially in the workplace. So this is just an overview. We get information daily from the CDC, from the New York Department of Health. Mount Sinai has been updating us with regular updates. We had one this morning. So this information is evolving and changing. So no question's a bad question, but this is the latest information we have. So I'm just going to give a brief overview, what it is, what to look out for, and how to keep yourself safe. So if you want to, when I typed this up about a week ago, there were 1,000 cases in New York City. Right now it's 1,965 cases as of last night. It accounts for about a third of the cases in the country. United States has about 9,500 cases and is the highest country right now in the world with monkeypox cases. One of the most significant facts is 98% of the cases have come from intimacy and sexual contact, whether that be men having sex with men or non-binary transgender men. But this is not something that is being spread casually through the work environment right now. There are some cautions that we're going to go over, but it really takes skin to skin intimacy to spread this. It is most contagious if someone touches an active lesion directly. So let's say somebody has an exposure, they have an intimate sexual encounter with somebody. Penetration is not required. It is the physical touching of skin to skin, which is why it has not been categorized as a sexually transmitted disease. From the time that they're exposed till the time that a lesion or rash breaks out is approximately 14, can be up to 14 to 21 days. There can be some symptoms prior to that, fever, lymph nodes, but the lesions are what are the most affected, the most contagious part of this illness. So if someone at work has a lesion on their arm and you touch it directly, skin to skin, there is a possible risk of transmission. If the lesion is open and weeping, that is obviously a higher risk. If it is a brief contact, hand sanitizer kills it. So if you touch someone and they have a lesion and you wash your hands right away with hand sanitizer, you have prevented the transmission. So the type of contact matters, but it's really seen to be spread through prolonged skin-to-skin contact in an intimate setting. It has been cultured in respiratory droplets. It has been cultured in sweat. It has been cultured in semen. It does not appear to be in high enough concentrations to actually cause infection. So when you go to the CDC website, you may see things like it can be in people's clothing, it can be in sweaty material, it can be on counter surfaces. Yes, it can be cultured in those areas, but we don't have evidence that it's in high enough concentration to be spread that way. So we could go to the next slide.
Okay.
So these are the symptoms that typically start, very nonspecific. Fever, headaches, muscle aches, swollen lymph nodes seems to be the hallmark. Fatigue. Who doesn't have fatigue? This could be COVID. This could be strep throat. This could be anything, that's going around. But if somebody's sick, they should do the courtesy to call out. There shouldn't be pressure to get people to come in. You have a fever, go home, see your doctor. Through an interview process, we can figure out if they're at risk for monkeypox and have that on the radar. There's no blood test that I can do to see if someone has monkeypox. The only way I can diagnose monkeypox, other than getting a great history and seeing if they're at risk from sexual behavior or something, it's only to culture a lesion directly. So the lesions, we're going to show a slide that's going to show you what the lesions look like. They're like large whitehead, pimples, but much larger than a normal pimple. But they can't be popped. If someone has herpes or if someone has a pimple, usually just by squeezing your fingers, you can get those to open up. These have a harder outer shell that really can't be popped. But what we do is we pop them in the office, we do a Q-tip, we send the Q-tip to the lab, and that's how a formal diagnosis is made. Most of the lesions are in the genital rectal areas, but they can appear anywhere on the body. These are some pictures of the pox on different pigmented skins. The most common and what I've seen is the fourth picture there, like a large whitehead pimple that has like a casing around it. It's a little bit harder. So obviously, if someone has a lesion, they need to stay home, because if someone touches these lesions, that's the greatest risk of spread. You should, if you have these pox, you need to isolate or stay home and away from people until not only they scab over, but you actually get fresh new skin in its place. So it can take up to 28 days that a person is contagious. So people are out of work for a long period of time. So preventing transmission is key. Now, if they cover it with a long sleeve shirt or they put a Band-Aid over it, much, much less contagious. So if you touch someone's skin, but you're not touching their lesion, you're probably fine, unless you have prolonged, intimate encounter. That is when you can get it even before a lesion appears. So it's spread through prolonged contact with a lesion or scab. Like I said, it's been cultured in multiple body fluids. It has also been cultured in objects, fabrics, and secretions, but this risk is almost not reported at all. I will tell you some statistics that will comfort you. As of last night, there were only 9 women in America who had tested positive for it. So it hasn't spread through casual contact or through respiratory droplets. Otherwise, we'd see numbers in women much higher. There have been 4 children in America who have tested positive for monkeypox, but we think that is more related to at a swimming pool, holding somebody skin to skin contact that way, or sleeping with children in the same bed, but not through this type of casual contact. The spread and the reason it's increasing is from the time that someone is exposed until the time the lesion breaks out. They are potentially contagious. I believe they are contagious. This has not officially been proven, but there is a period of time that the virus is growing, the viral load is growing every day. So every day after exposure, there's a little bit more risk of contamination. But again, this is through intimacy, skin to skin, sexual contact, that it becomes the greatest risk. They said today at the update, if you are having close face-to-face contact with respiratory droplets, you would need about a 3-hour exposure to get respiratory drop contact to have enough viral load to maybe even get the infection. So, and we haven't really seen it transmitted that way yet. So obviously the first thing is we don't want people touching a lesion. That's probably the most important thing. Lesions can be covered. If someone has a lesion, they need to go to a doctor. They should not return to work until they're officially cleared by their doctor. At work, wear masks when possible, which we should be in the habit of anyway. And I do think if you're touching laundry or you're touching costumes, wearing gloves as best as you can, latex gloves or medical gloves, are the best way to protect yourself. If you touch someone's skin and you're just wipe down with hand sanitizer. If someone puts sweaty clothes on your desk, just wipe it down with a wipe. It kills it very easily. Soap and water, works if you wash your hands. This is not COVID-19. This does not spread like COVID-19. You can't get it from coughing and sneezing. The risk of transmission is much lower. It's a completely different ball of wax. So there is a vaccine available. The vaccine has existed for decades. Problem is it hasn't been produced in decades because it hasn't been this transmissible until recently. So they are currently making vaccines as fast as they can. Just like when we rolled out COVID vaccine, we gave it to the highest risk individuals first, which were elderly and people immunocompromised. This is what the CDC and New York State guidelines are considering the highest risk individuals. So right now the vaccine is only available for people who are over 18, who are gay, bi, or other MSM, men who have sex with men, and or transgender, gender nonconforming, non-binary, and attest to having multiple sexual partners or have had anonymous sex in the last 14 days. You just have to attest to this. Nobody's going to do a screening of your private life. If you are very concerned, there's vaccine available. It's in limited supply, but if you're persistent, it's out there. But we do want to try to save it for people who are at highest risk, so you have to meet this criteria. In New York City, you can text the word monkeypox to 692-692, and they will send you updates and send you to the link to the Department of Health website where appointments are being made. As of yesterday, I checked it out. There are appointments available. Not a lot, but throughout the city, they have some in Inwood, some in the Bronx, some in right here in Times Square. So if you're persistent and you check in every day, it's available. You can also go to vaccinefinder.nyc.gov, which is the exact same website we looked up COVID vaccines. And there's now a tab for COVID, and now there's also a tab for monkeypox, and you can see what's available. Some of the hospital systems are starting to get availability. So over time, there'll be more vaccine available. But right now, the hospitals are getting it from the health department. It's being managed slowly through the Department of Health. So if you're in LA, Chicago, another city, literally just Google the city that you're in, Department of Health, the phone number will pop up, and give them a call, and they will direct you to how to get scheduled for a vaccine. So the monkeypox vaccine is traditionally 2 immunizations. First one, and then about 3 or 4 weeks later, you get the second shot. Right now, the world is going by a 1-dose vaccine right now. And we're finding that's about 80% effective. And it has been successfully slowing the transmission of monkeypox. The transmission is actually down in New York City, which we think is due to the vaccine. Wherever you go for the vaccine, they will keep your information and call you back for a second shot when and if they become available. But that right now just depends on supply. So it's important to know you're not 100% protected after the vaccine, but you are greatly protected. You would be 100% protected about 2 weeks after the second shot. Some people have been vaccinated against smallpox. They stopped giving smallpox vaccine, I believe, in 1972. Most people who have smallpox vaccine have a little scar on their arm. Those people they're finding are probably already about 85% protected against monkeypox already. You can still get the monkeypox vaccine if you're at risk, and I think that's a good idea, but you do have much more protection already than someone who's not vaccinated. Side effects are very minimal. It's only contraindicated for people who are allergic to gentamicin or ciprofloxacin, and that has to be an anaphylactic reaction. If it's a mild rash or something, you can still get the monkeypox vaccine. And if you have anaphylaxis to egg protein, they're not recommending the vaccine. Other than that, there's no contraindication for people getting the vaccine. It's very well tolerated. Some people get a redness at the injection site, which resolves over a couple weeks. We saw a similar rash in COVID vaccine for some people. The last sentence there says, if you've recovered from, so if you had monkeypox, should you get the vaccine? You can, but you have enough antibodies that you don't need the vaccine right away. You should probably save it for people getting their first vaccine first. So these are questions that people sent in prior to registration that we can kind of walk through and then see if there's more questions at the end. So what are best practices for employees known to be exposed? So anybody who has been exposed, it has to be careful about their sexual partners because that's where you're at greatest risk of spreading it. From the time that you're exposed to the time you have symptoms, you can get vaccinated. And actually that's encouraged. You can give this vaccine as a post-exposure prophylaxis. So again, you'd call the health department or call your medical doctor and say, I was just with somebody, we had sex. They called me 4 days later and said they broke out with pox. I've been exposed. And if you can get the vaccine in that window, you could prevent getting the disease during that incubation period. If you worked with somebody and they end up calling out sick a week later, your exposure is very, very low. Again, I'd be more concerned about intimate sexual partners than I would about coworkers. Obviously, keeping gloves, hand sanitizer, masks at work when you can. Is there a treatment? There's lots of things that can help. So there's symptomatic relief. A lot of people have pain, which responds to lidocaine gel. We use Claritin or antihistamines to keep down the itching and inflammation. Tylenol is very effective to help with the pain. However, rectal pain for people who get proctitis can be extremely painful. And if the pain or the symptoms are severe, there is a medication called Teapox, which is a smallpox treatment, which is being used off-label for monkeypox treatment. Again, limited in short supply. You have to get it. They will only give it to you if you've been properly diagnosed. So you have to see your doctor. You have to get a culture. The culture has to come back positive. And then we have ways of either going through specialty pharmacy through the health department to get people the medication to help with symptomatic relief. But it's a process. But there is treatment available. It's just, again, guarded because it has not been given FDA authorization yet. So it's being used off label and it's in limited supply. Is a rash or pimples a side effect of the vaccine? No pimples, no pox will come from the vaccine. Again, just maybe some local redness at the immunization site. How should you handle early stage symptoms? So you get lymph nodes, you have a fever. Like I said, that could be anything. So you really should see your doctor, get proper testing, get a COVID test. Anybody who has monkeypox symptoms, we have to see if they're at risk for sexually transmitted diseases. And if you're at risk for sexually transmitted diseases, then we have to consider monkeypox in the differential. Are you contagious at the moment of contact or when symptoms start? So again, this has not been proven. I believe that you are contagious from the moment of contact, but very, very small viral load, and that will grow over the next 1 to 2 weeks. And you are most contagious when you have pox or the distinctive rash.
That is actually all the questions that we have on the slides, but we did get some questions in the chat. So let me just read the question that I have in the chat. And let's see. The first question actually is, do you have any idea why it's called monkeypox?
So it was originally spread from primates when it was diagnosed or first discovered, years ago. It also can come from rodents, and they think that this specific strain came from rodents and not monkeys, but.
Got it. Is the 28-day isolation a minimum, a maximum, or an average? And is it possible for someone to recover in a week or two?
Yes, I think the 28 days is up to, for the most part, but it really comes down to the skin condition. Yeah, you're cleared to go back to work when the pox are gone, the scabs have fallen off, and your skin is back to normal. At that point, we think you're no longer contagious. Excellent.
Next question. This is a multi-parter. Is travel unsafe? If someone is on tour and tests positive, is it recommended that they remain in their tour city or hotel for the duration of their isolation, or can they fly home to recover?
You want to isolate from people. If you travel, you want to have a mask on. You want to wear long sleeves. You want to make sure there's no visible lesions. So it depends where the lesions are. If the lesions are on their face, they probably shouldn't travel unless it can be covered with a face mask. The lesions can appear anywhere, but as long as they're not skin to skin touching people, they can travel.
Okay, next question. Actor/costume safety recommendations.
So like I said, it has been cultured in sweat, so material can have it. It's probably at not high enough concentrations to cause infection. We haven't seen that anywhere yet. So it's listed on the CDC website as a potential source, but it's not happening in reality. I would think, I know people spray the costumes down with vodka. I searched all night. If vodka kills it, I can't find that. Hand sanitizer does, soap and water does. I know some of the costumes are not laundered because of the, they're so, so sensitive and difficult. So I would hope understudies, have their own costumes and they don't get from one sweaty costume into another, but unless the person before them had active open lesions that were opened up and got onto the costume, and then that's on somebody else's skin for a couple hours, I really think there's no risk. There's a theoretical potential risk, but it's not happening.
Great. All right. Next question. With such a low level of transmission of monkeypox, you said only 9 women have been diagnosed in the US as of last night. Are we going to see radical safety measures as we currently see with COVID?
I would encourage everybody to have plenty of hand sanitizer, cleaning equipment backstage. I would encourage people to use gloves whenever they can, especially when handling material, costumes, sweaty costumes. I would encourage, as I think we're already using, masks all the time when you can at work. And I don't think I don't think there's anything else that's required in the workplace.
Okay, the next question, actually, I'll answer offline. So the person that asked it, I will definitely follow up with you offline. Following question, how at risk are you when traveling in airplanes? What precautions to take? So I think we went over that before.
I think that's a very safe activity.
Have you heard or do you have any information on if this is covered by workers' comp? If you think you got it at work?
I don't know, but I don't know of any work-related cases. Mount Sinai Hospital has had no staff that's gotten it from patients. There's been no work transmission, through my health system. And I think that's what we're seeing across the board. So it hasn't happened yet.
Okay. Next one is, what is the definition of intimate relations, and does that include grappling or wrestling?
Yes, hot, sweaty, skin to skin contact for 10, 15 minutes. Again, it depends how big the lesions are. It depends if they're immature. It depends how high the person's viral load is. But I think, but yes, if someone goes to an underwear party and they're rubbing up against each other's skin, that would count to me as intimate skin to skin body contact. And if that happens for 10 minutes plus, that person could be at risk.
Okay. Are there extra precautions we should be talking about for hair, makeup, or wardrobe staff?
No. Masks, gloves. If you feel you've touched somebody's skin, you're dressing them there, and you've touched them, just as soon as you're done working with them, little hand sanitizer, you're not at risk.
Great. What are the long-term effects, if any?
None. It goes away. It's very uncomfortable. This will not kill you. The pain can be unbearable, specifically the genital rectal lesions. People describe it as like, passing shards of glass. It can be so painful. And because it lasts for a long period of time, a lot of people are admitted to the hospital just for pain control. But other than that, there is no long-term consequences.
Okay. Any recommended preventive measures for performers who are in continuous skin-to-skin contact during rehearsals or performances? I'm guessing maybe dancers, etc.
Yeah. The best advice I can give is please tell everybody, if you're sick, stay home. If you have a fever, if you just are sick, stay home, get tested, get cleared to go back. If someone has an active lesion, they have no business being at work, and that would be the only way I really think you could get it, through dance, through, sexual scenes on stage. You'd have to really come in contact with someone who is sick. And
should wardrobe staff wear gloves at all times backstage, do you think? Is that prudent?
As much as they can. I know there's buttons and stuff. It's not always available, but you could take them off for that and then hand sanitize, but put it back on. But if you're worried, it just makes it non-transferable if there's a barrier. So it's just something to put your mind at ease. I do not wear gloves to see all my patients, but when I'm culturing somebody's lesion, I'll put gloves on at that moment,
Got it. I have a question about why this is considered a health emergency when clearly it's not, according to the writer of the question.
It's spreading fast. It's mutated. It's a different strain of monkeypox. When anything mutates, it's unpredictable. Certainly, if this spreads into a heterosexual population, elderly population, if someone's immunocompromised or very young children, it can be much more serious. There are deaths associated with it in third world countries, not with this particular strain, but with other strains. We haven't seen that with this, but it has the potential to mutate and change. The quicker we can put the fire out, the better.
Got it. Would on-stage love scenes that involve kissing be an issue?
No, because respiratory droplets, the viral load's very low. Unless someone would have a mouth lesion, then that would be a risk, yes.
Okay. Someone's asking kind of a culture question. For someone who starts to exhibit lesions, pre-lesions, would you recommend a company member stay home for a period of time before returning to work to ensure it doesn't develop into lesions? It's ingrained in people to push through and not stay home.
Yeah, I mean, if someone has a fever or it could be COVID, and you could take out the whole cast. So we are just working in a time that if you don't feel good, please be cautious and stay home, get cleared, get returned to work safely. Anything, even the flu can go through a company and take down lots of people. So it's just a common courtesy. If you can't work with a mask on, you shouldn't go to work. If you can work with a mask on and you use precautions, you're probably safe going to work if your symptoms are mild.
Should dancers be wiping down their skin after partnering during a show?
You can. It's an extra precaution, and it will definitely kill any virus that might be there.
Can it be transmitted through the floor, i.e. with dancers who are doing floor work?
It can be on a surface, but surface spread has not been reported yet. Again, I don't think the viral load's high enough to actually cause infection from a surface transfer.
Can someone be contagious when the lesions are not fully visible yet, given that the dancers in many shows have extended skin-to-skin contact?
So that has not been proven, but my belief is yes. The longer someone has had the virus, the higher the viral load gets. And then the more skin contact could be a potential source of contamination. Again, I'm defining that as 10 to 15 minutes of hot, sweaty, skin-to-skin contact. If that's happening during performance, yes, wiping down with some hand sanitizer will treat this before someone is able to get infected.
Great. We have no more, here we go. All right, we've gotten to almost the end of the questions. Are lesions on the mouth always visible? Meaning, are they also inside the mouth?
Yes, they can be inside the mouth. So the patient would know that they have them. You might not know kissing someone that they have them. So patients, again, if someone feels something's funny, they should not come to work that day if they're in a kissing scene. But the patient would know they're there because they would feel that they have discomfort associated with it.
Can you speak more about those with eczema? Should they be doing any extra precautions? If they get monkeypox, is their recovery any different than someone without eczema?
Yeah, there's some reports going around about that, but we went over this morning again. Eczema is not a contraindication to getting the vaccine. It doesn't seem to have any overlap with monkeypox. They look totally different, but if someone has eczema and they're not sure if it looks different, then go to a doctor and get properly diagnosed and make sure it's eczema. But atopic dermatitis is not a contraindication to getting the vaccine.
Okay. If the risk of transmission is as low as we're hearing, what do you think accounts for the near doubling of cases over the past week?
It's mostly men having sex with men. It's really where we're seeing it. We don't want to identify it as a gay disease, so they've been very cautious in the wording. But in practicality, we are seeing it in men who are having sex with men. And that may cross over into other populations, certainly non-gender conforming, non-binary, transgender are at risk. And if it continues to spread, and if we don't contain it, it will spread into the heterosexual cisgender population. And that's why we're trying to contain it now.
Great. All right. That is the end of the questions. Is there anything that you want to wrap up with, Jason, before we thank everybody for joining us today?
So I really think the take-home point is the workplace seems to be an extremely safe environment. You know, things are reported that I wish I could say 100% no chance, but the risk is so low. So we have to report that it's been cultured in respiratory droplets and clothing, but the actual risk, we're not seeing it. And you can see that in the statistics. 98% are men who have sex with men. Only 9 women in the country have been tested positive so far, only 4 children. So I really feel most of us can feel pretty comfortable in our work environment. And taking a little extra precaution is just smart.
Great. Thank you so much. You're getting a ton of thank yous in the chat area. I'm sure if this were a theater, there'd be a standing ovation. Thank you so much, Jason. There's a lot of information that you provided that's difficult to find online, and you are so knowledgeable about this. So we greatly appreciate the time you took. I know you're not feeling so great today. So thank you so much for this really valuable information. And thank you to Courtney for the interpretation services. We greatly appreciate that as well. Thank you very much, everybody, and have a great day. Stay safe.